I have to tell you, I'm going to talk about GIS. Well, I was asked to give a little bit of information about who I am. So I am Jan Scarlett. I am an epidemiologist. I was the former director of the shelter medicine program, which I have now handed the reins over to Dr. Berliner, who you may or may not have heard speak earlier. And I did that with great relief, but also great promise on her part to do a wonderful job. I've been in sheltering for a long time now, and one of my interests is spay-neuter and the effectiveness of spay-neuter programs. So I'm going to talk today about what we believe is a very promising new quote-unquote, it's actually been around for quite a while, but certainly new to shelter medicine, the use of geographic information systems to help us better target spay-neuter efforts. And I'm going to explain a little bit what GIS is in a minute, so just hang in there with me for a few minutes. What I want to do first off, though, is give credit to Dr. Anna Reading. The bulk of what you're going to see is something that Anna did. She came to me when she was a first-year veterinary student, said she was, in her former life, a GIS technician, and that she was interested in shelter medicine in homeless animals, and she thought that her skills could be utilized to help us better focus in on where our homeless animals were coming from. And she said, do you think that would work, and could I work with you? And I said, yes, because I do not have training in GIS. Of course, Dr. Berliner and I have been supervising Anna, or when she was here. She's now Dr. Reading, and she's graduated and practicing in Arizona, so we lost her and her skills. And then I also want to thank Jim Boudreau. For those of you who don't know, Jim is the executive director of the Tompkins County Shelter, and his staff, because the data that most of the data I'm going to show you today are in fact from the Tompkins County Shelter. Incidentally, you are in Tompkins County. So Tompkins County Shelter is the shelter that serves the community in which you are currently sitting. So you all know this. We have lots of cats in the country. This most recent AVMA survey suggests somewhere around 74.1 million owned cats. Interestingly, and I just highlight this, we don't really know for sure because there's variability in the way that these surveys have been done over time. They've now launched mostly into internet-based surveys, and whether you get the same information from internet-based surveys as from postcard mailed surveys is unclear. It looks like there may have been a decline in cat ownership. That would be consistent potentially with the economic downturn that happened between the last two surveys. Not clear yet. I think we're all kind of waiting to see whether that really bears out to be true. But keep that in mind, because we're going to talk a little bit about some of the issues and problems of evaluating whether or not GIS is actually working. And I think that may play into may help confound some of our interpretation of the data. The other thing that we have with cats that we don't have with dogs is a large free-roaming population, at least here in the United States. And nobody knows for sure how many of these there are. The estimates that I think that come from the people who are most knowledgeable put it somewhere around 35 to 40 million, half again as many as there are owned cats. We really don't know. There are millions of them. I think we can say that with 100% surety. And the other thing that I think we have pretty good data on is that the vast majority of these animals are not sterilized. And those of you who work with cats, which is probably all of you, you know what reproductive machines they are. They are very fertile, incredibly able to reproduce themselves. We have some data about what's happening on intake. I think it really does vary by the region of the country. Interestingly enough, some recent work done in all of Colorado, almost all of the shelters in Colorado, and a very large proportion of the animal control delivering shelters in Ohio would suggest that their intake in cats was increasing. Again, is that a reflection? I mean, it certainly depends on the area of the country and how economically hit they were by our recent recession, depression, whatever you want to call it. And so this also may, especially if you're using GIS and then want to see whether it has an effect, if you've got increasing rates of cats coming in because of other factors, it may mask or blunt the effect of your spay-neuter, targeted spay-neuter efforts, if in fact they are really effective. And then of course you all know that we have much higher euthanasia rates across the country in cats than we do in dogs. So effectiveness of our spay-neuter programs. In dogs, we have seen for the last 3 decades, 2.5, 3 decades, in most parts of the country, a decline in dog intake. Throughout the country, with the exception of probably the Southeast. And then even there, more recent data would suggest, at least in some communities, they're seeing a decline in dogs as well. We've been neutering dogs, and not necessarily just through, predominantly not just through our shelter populations and spay-neuter clinics, but rather our veterinarians have been recommending and pushing spay-neuter in dogs for a long time. They've been pushing it for cats. I think people view cats very often differently. Although the neuter rates, if you actually look at neuter rates among dogs and cats, the neuter rates in cats, owned cats, are higher than they are among dogs. So in fact, it strongly suggests that this free roaming population that are largely unneutered that really contribute most predominantly to our cats in the shelters. The cat intake, for whatever reason, I think it's the one I just spoke about, but has remained relatively stable, and in some communities actually increased. There are certainly exceptions to that. And I was talking with somebody last night who was telling me about a community in Massachusetts where, in fact, they're seeing a fairly steep decline in cat intake. So that's a good sign. I'm hoping that is foretells a trend that will be more widely seen throughout the country. There are several studies in communities that have had spay-neuter programs. And now I'm talking about not only the veterinarians doing spay-neuter, but also the spay-neuter clinics and the shelters really ratcheting up their efforts to do spay-neuter. It is disappointing, and there aren't very many studies, and these studies aren't necessarily easy to do, so I'll preface my remarks by that, but the studies that are out there either suggest no effect after thousands of surgeries, or a very modest effect, much less than what we would like to believe should be happening given the number of animals that are often involved in these spay-neuter programs. I mean, thousands. We're not talking about just 100 animals or 200. We're talking about thousands, in some cases, tens of thousands of animals. So why is that? Why, despite all our efforts and the thousands of animals that we've done, why is it that we can't really demonstrate an effect on intake, or at least it's a very modest effect on intake? And I don't think we know for sure why that's true. I mean, one of the contributing factors is this large free roaming population, and tied to that is our data and these are simulation models. So again, simulation models have their place, they are valuable, they are only as good as the data you put into them and the assumptions on which they are based. And so the couple of studies that have been done in cats suggest that you have to reach somewhere between 75–80% of the reproducing females in a population before you actually see a decline in the reproduction rate in that population. If we have thousands of free-roaming cats, like we think we do in any community, depending on its size, of course, are we truly reaching that population at the level that we need to really stop the reproduction going on there? Certainly one of the stronger hypotheses to explain why we aren't seeing an effect. The original TNR programs were not just to go out, trap as many cats as possible, come in, bring them in and neuter them. And actually TNR was not necessarily started for cats, but often was done with dogs in countries where we do have a lot of free-roaming dogs. And the initial theory was that you would combine TNR and the TNR with education, with removal of food sources, so that you kind of discourage them from reproducing and going on to keep multiplying. And the other part of it was that you would look at an area that you were going to do your TNR efforts, and you would carve out a doable piece, and you would go in there and blanket that one area and do 80, 90% of the animals in that area. And then once you had that area pretty much done, you moved to the next area, and you went after that area. And then and keeping an eye on this area, because you have to go back periodically because you're not going to get every single cat or dog. And you would work your way slowly over time to encompass the whole area that you really wanted to work with. So we really, and I'm going to talk about this a little bit more, that we really haven't complied with that model in many or most of our programs. And then, are we really reaching the source? Are we going after, are we getting enough of these free-roaming animals? And are we really reaching, even among the owned animals, are we really reaching the people who end up surrendering their animals to the shelters? And then another question is, have we had just not enough time? Have we not been doing the neutering long enough, like with the dogs intensively, now in this large free-roaming population, to really see an effect? So I don't have the answer to what I think it probably is some of, maybe all of these things. I do want to talk a moment about the approach of many of our US spay-neuter programs. In most of them, the clients will self-identify themselves, if for owned animals at least. And in many cases, even it's the people or volunteers that are going out to get the stray animals that are kind of identifying themselves and going out and getting animals and bringing them in. And are these people kind of somebody said to me earlier, the kind of the low-hanging fruit. We're going after the low-hanging fruit, the ones that are easy. They may have even gotten those animals neutered anyway, or they're not the people who normally come in to surrender animals to shelters. They're the ones that find homes for those kittens or whatever. Perhaps we are just, even though we're doing lots of animals, and we're doing good, because I think there are two pieces of spay-neuter. One is to try to diminish intake into shelters. That's one goal. But the other goal is to provide for a better life for that animal. That is to reduce the risk of mammary tumors, to reduce the risks of having repeated litters, to reduce the hormonal levels that frequently lead to the behaviors that cause relinquishment into shelters. So please don't go away and think I'm not saying that spay-neuter isn't really important and that we're not doing something really positive by spay-neuter, but if one of the goals is to diminish intake, maybe we're not doing it in the most efficient way, and the way that will most likely lead to declines in intake. By going and and letting people self-identify, we aren't going in, blanketing this area, getting this area under control, moving on, getting this area under control. Now, why aren't we doing that? Because it's very expensive and labor intensive. And many of the models that have been set up to sustain economically our spay-neuter programs can't afford to do that, or else their fees would be much, much higher and they wouldn't be able to compete. So again, I'm not being highly critical of them. I'm simply saying that they may not be serving the goal of diminishing intake into shelters. So certainly thinking about trying to identify who's coming into the shelter and how they might be contributing to overpopulation is not new. I mean, people have thought of that before, and people have used zip codes, they've gone back to particular homes, and so this, using GIS, I think, is a variation on that. It's a refinement of that approach, of saying, well, you know what? We actually know where our animals are coming from. It's very hard to think of a shelter that isn't collecting information, at least from the owner-surrendered animals, about where those people live. We get their name, their address, their zip code, their phone number. So we have, or should have in most cases, pretty darn good information, at least for owner-surrendered animals. And maybe if we thought more about it, we could get better, and tried harder, we might get better information about where our strays are coming from. So if we could have good information to localize where they came from, then we could use this geographic information system approach.